Understanding endometriosis and its significant causes. Not sure what endometriosis means? Well, this is a very painful disorder in which tissue similar to those lining the inner walls of your uterus, called the endometrium, grow on its outer part. This is a condition that usually affects your ovaries, fallopian tubes, and the pelvic tissues. Before we go into details about this reproductive illness, let us advise you to schedule a checkup with the best endometriosis specialist Kolkata if you're suffering from endometriosis. Detailed overview. In case of endometriosis, the endometrial-like tissues act similar to original endometrial tissues, thickening itself, breaking down, and bleeding out with each menstrual cycle. When endometriosis is linked to your ovaries, a cyst called endometriomas tends to form. Endometriosis can cause severe pain, especially during menstrual flow. Plus, it can trigger problems related to fertility as well. It's a blessing that effective treatments are there for it. Probable causes. Though the exact cause for endometriosis is uncertain, there are certain theories about its origin. Menstrual backflow. This is what's known as retrograde menstruation, in which menstrual blood comprising of endometrial cells goes back through the fallopian tubes and discharges into the pelvic cavity instead of expelling from your body. These cells stick to the pelvic walls and other pelvic regions where they thicken and bleed during each menstrual cycle. Conversion of peritoneal cells. This is scientifically termed as the induction theory, which suggests that hormones or immune factors induce transformation of peritoneal cells on the inner side of your abdomen into endometrial-like cells. Transformation of embryonic cells. It's believed that often hormones like estrogen hold the potential to transform embryonic cells during their initial development into endometrial resembling cell implants at the time of puberty. Surgical scar attachment. It's not rare for endometrial cells to stick to a surgical incision after a surgery such as hysterectomy or C-section is performed. Transportation of endometrial cells. Another factor that leads to the occurrence of endometriosis is the transportation of endometrial cells to other parts of your body via blood vessels or tissue fluid. Immune system defect. A disorder with your immune system may prevent your body from identifying and destroying endometrial-like cells that are growing outside your uterus. Take up consultation with the best gynecology doctor in Kolkata to be correctly diagnosed with endometriosis and undergo advanced treatment that such a skilled gynecologist will implement using latest equipment with excellence and empathy.